The assisted standing pivot transfer should be used when a patient can sit, stand, pivot, and bear some weight on their legs, but is experiencing some weakness, paresis, paralysis, or loss of balance or sensation that requires assistance to transfer safely. By a variety of hand positions, a physical therapist can vary the amount and type of assistance provided to the patient performing this transfer. If you place your hand under the patient's buttocks, you can assist by lifting as a patient rises to the standing position. By placing your hand on the side of the patient's pelvis, you can guide the patient as she rises. You will be in a position to control excessive sideways shift of the pelvis. Also, your hand can be moved quickly to the posterior of the pelvis if necessary. If you place your hand on the front of the patient's pelvis, you can guide or resist movement as the patient rises. This will teach the patient to bring the pelvis forward as they rise. A patient must be able to transfer to both sides. When teaching a patient to transfer, moving toward the uninvolved side may be easier and safer initially because they are moving toward the side where their lower extremity can provide support. When the patient is going to transfer from a wheelchair to the treatment table by turning to the right, the wheelchair should be placed parallel to the treatment table with the table on the right. Remember to engage the wheel locks. The patient's feet should be placed on the floor, foot plates raised and footrests removed from the wheelchair or swung out of the way. The patient will need to move forward to the front of the wheelchair, with or without assistance. The patient is positioned on the front edge of the wheelchair seat, knees flexed at approximately 100 degrees, feet flat on the floor. See how the therapist is guarding the patient's right knee with his right knee and the patient's right hip with his left hand. This position will prevent the patient from collapsing at these joints. The therapist should place his right hand on the patient's left shoulder to prevent the patient from falling to the left. The therapist's right knee is lateral to the patient's right knee. The therapist's feet should be in stride with his right foot forward and medial to the patient's right foot. This will provide a support base in the direction of the transfer and will permit patient and therapist to move freely. The patient initiates standing by leaning forward and moves to the standing position by pushing down on the armrests of the wheelchair with her upper extremities and extending her lower extremities. A full controlled upright position is attained. The patient then pivots to the right, toward the treatment table. The patient lowers herself onto the treatment table with assistance if necessary. The therapist must continue contact support until the patient is in a safe and comfortable position.